My name is Dr. Albert Pacharek, and I'm here to tell you that we've all been lied to. The Obama administration has created a sense of urgency. Healthcare is broken and it needs to be fixed. We've been told that 46 million Americans are without health insurance. I'm here to tell you that both of those statements are untrue. Healthcare in the United States is of the highest quality. In fact, no country in the world can boast of a healthcare system that has such a high level of quality. We don't turn anybody away. In fact, for those people without health insurance, there are charity and philanthropic organizations that help them with their medical bills. Over the last 20 years that I've practiced medicine, I have yet to see a healthcare organization take away someone's home because of unpaid medical bills. This is not to say that our system is perfect. No, it's far from that. There are people that fall between the cracks. But overall, everyone has access to health care. As pertains to the 46 million Americans without health insurance, we've searched and searched to find where the Obama administration got their facts. The closest that we can get is 26 million. However, when we remove illegal aliens from that number, remember, they are not U.S. citizens. We find that the number is actually closer to 16 million Americans without health insurance. This is less than 5% of the U.S. population. And most of these people are young, healthy adults between the ages of 21 and 35. We find it hard to understand how anyone can think this is a tragedy. My fellow Americans, we've been lied to again and again. Why? Because there appears to be a very different plan behind this health care law. Unlike many of those in Congress, I have actually read the bill. Believe me when I tell you, this law was not created to improve health care. It was created to take over health care, to move it from the private sector to the public sector. It's a government takeover of a private industry. This law will not improve the quality of health care. It will not decrease the cost of health care. It will, in fact, grow government. Currently, 22% of the U.S. population works for the government. Their salaries are paid by tax dollars. The healthcare industry in the United States makes up 1/6 of the total U.S. economy. When the government takes this over, we will have 35% of the population working for the government. My question is, how will the remaining 65% of the population be able to afford to pay those salaries? Remember, government employees make about double that they would make in the private sector. This is going to bankrupt our country. The only way that we can save ourselves is by repealing this law. If you want to make healthcare less expensive for all of us, then there's a few very simple things that we can do, and it won't cost us any money. First of all, we can allow people to buy insurance policies over state lines. This would increase competition amongst insurance companies, and it would decrease premiums. The next thing we can do is to make insurance policies tax deductible for individuals. And we can also allow employers to contribute to those policies and make those contributions tax deductible as well. This would make individual policies portable. In this way, people are not tied to a specific employer. We can also remove government mandates from these policies to allow people to have more flexibility when choosing a health policy. This will make them cheaper. The third thing that we can do is we can enact tort reform. Not by limiting the awards given out to claimants, but by requiring claimants to pay for legal fees if they are not able to win a case against a physician. This would cut the cost of frivolous lawsuits overnight by 90%. Remember, doctors are forced to practice defensive medicine. If the specter of frivolous lawsuits is removed, then their liability insurance policies will fall. This would create a drop in healthcare costs from between 25 and 35%. The last thing that we can do is a reform, an overhaul of the Center for Medicare Services and for the Department of Health and Human Services. There has to be an accounting in these organizations. They carry too much overhead, and there's no accountability as to what they do. Who takes responsibility for their actions? CMS creates all the price schedules for medical services and transactions in the United States. There is no logic in explaining why they pay so little for certain services and so much for other services. This reflects how lobbyists and politicians have exploited loopholes in the system to the benefit of big business and special interest groups. These groups are not doctors, yet they retain most of the funds paid out by CMS. If there is no overhaul in these organizations, we will never get a handle on the cost savings in the United States in regards to health care. If these 4 simple measures are implemented, we can cut health care costs in the United States by 50%. And best of all, this won't cost the taxpayers any money at all. No increased growth in government and no increased taxes to cover a government single-payer insurance program. It's simple. We must, however, start by repealing the bill. Thank you for your attention.